Hi, hello everyone. Good evening. Hi, can you hear me, guys? Can you hear me?
Hello,
Okay.
sir. Yes, sir. Yes,
Oh,
sir.
good evening. Hi,
Good
guys.
evening, sir.
Okay, so I'm still traveling. I'm taking this class from a hotel, but that's okay. So guys, some clarifications before we go to the class. First of all, I welcome you all, and there are 200 more students who will be joining from the next class. Okay, right now they are in the SPSS class, right? They'll be joining us for sure in the next class. But before that, as this is a very specific course, and this is a very super specialized course, and we deal only with ECG interpretations here. I'm sorry for the delay to conduct this course, to start this course, because last week I was suffered with the COVID, and I was isolated for a few days, and then I have to travel. Right. And I always when that's why I stopped, taking some classes, because I have a lot of travel and lot of busy schedule. But this course, uh, was in very much demand, and many people were asking, so I had to start this, and definitely we will complete it. As early as possible. This is for, I think, 3 months, but we will complete it before that only. And I'll make sure that your classes are completed and you get all or more than whatever we are, saying in the flyer or brochure. Right? You must have seen that, right? We will cover everything. I'll teach you all the ECG parts which are needed for the basics, which are needed for the things, and including all anatomy of the heart, and arrhythmias, and how to detect ECGs, how to calculate the heart rate, how to go for multiple things. Whatever is needed, I'll teach you. But again, with me, there'll be a problem. As I always, when I start any course, personally for me, I always tell that yes, days will not be confirmed when I am taking the class. I'll be telling you in advance. I'll be trying to complete the classes on Tuesday, every Tuesday. But sometimes if it is not Tuesday, then I'll be taking one or two classes every week, or three classes, so this course gets completed as soon as possible. I'll be asking you definitely that when you all are free, and when I'm free, we will do that. And we will not only take one class. We will have at least 2 to 3 classes a week, maybe some in the weekends, or not in the weekends, right? But definitely, because of my very busy schedules and very busy traveling part, I'll not be, or I may not be able to take it on 100% on Tuesdays. Right. So I want a little cooperation from your side. But yes, whenever you will be free, I'll take that classes. Okay. And that's why I'm starting today, because a lot of back classes were there in the group as well. I have seen some students where, that's not their fault as well. Because when you pay a little money, or some money, we always look forward. And some students are not aware about me or my organization, how I do everything is on time, everything is perfectly running, and in behind. But this course is only I have to take, right? This course only I take. So whenever I take the classes, whenever I have some courses to take, I always mess up because of the travel, or I couldn't match the timelines, or
Sir, you are not audible.
am I not audible, guys?
Yes, yes. You're
You are not
audible.
audible.
Ma'am, I think I'm not audible to you, but audible to everyone. Please check. Please check your mic, or please check, the things, Dr. Akhila.
Now it's fine, sir.
Okay, thank you. Okay, so guys, we will start it today. So I'll be starting today with the anatomy of heart, because that is one of the integral and very important part to learn first. Okay, so I'll be keeping my video off because it is distracting much. I can see in background this TV is running. Okay, so let me say here. Okay, so this is the first class, right? Basics of conduction system and ECG, right, guys, where I'll be discussing these parts. And one more thing, I am not carrying my pen. Actually, I usually teach with the pen and pad, or maybe in the iPad usually, where I can tag, or I can teach you in the live screen, right? So I'm not carrying the that pen also, so you have to bear it without pen, but I'll explain everything how I explain with the pen as well, right? So let's start. So today we are going to discuss about the heart. We are going to discuss about the conduction system. We are going to discuss about the electrocardiogram basics. And then definitely, if you have any questions, you can ask me anytime here or in the group, right? So can I just, yeah. So can you tell me, after looking at this, like, what is the exact flow of the blood in heart? How it flows? How the blood flows in the heart? Can you tell me in one sequence? Either you can open your mic or you can tell me in the chat box. See, everything is there, but still you have to tell me like what is the flow, because there are some arrows which are contradicting to each other, right? And before you tell me, let me tell you. So this there are as I think you are not that naive that you don't know what are the chambers and how many chambers are there, but still let me tell you there are four chambers in the heart, right? So these two are upper chambers, this one and this one, right? And these two are lower chambers. These two are lower chambers, this one and this one. So upper chambers are called atrium or atria, right? Upper chambers are called atrium. Two atriums are there. So both the sides, like left side and right side. So right side atrium is called right atrium, and left side it is called left atrium. This structure is left atrium, if you can follow my cursor, and this is right atrium. And below that there are right ventricle in the right side, and left side it is left ventricle. Okay, so there are four chambers, two upper, two lower. Uppers are called atrium, lowers are called ventricle, right? So now can someone tell me this flow of the blood in heart? Okay, someone has written, oh, Rang, very happy to see you again. IVC to RA to RV to pulmonary artery to pulmonary vein to LA to LV to aorta. Wonderful. Yes, anyone else? Is it correct, guys? Is it correct? What Rang has written here? Is it correct? Or do you have any other comment? Okay, wonderful. So, see, guys, this is the flow, right? So, usually, when the blood, absolutely, you must know that there are, two types of, vessels in the body. Two types of vessels. One are called, veins. One are called arteries. So, arteries which carries the oxygenated or pure blood, right? And veins are which carries the impure blood or deoxygenated blood, right? Deoxygenated blood, which is not having the 100% of oxygen, which is impure, right? So how it has become impure? So it becomes impure because it collects all the other gases, from the cells of the body, from other organs of the body. It collects all the other gases. It reaches, it carries the nutrition and oxygen to those cells, and leave that oxygen there and collect all the other gases or other materials or foreign particles, or unused or used particles or gases from all the cells, all the tissues, and carries back to heart, right? Carries back to lungs, right? And in the lungs the blood gets purified, and to the heart, the vessels which carry the deoxygenated blood or impure blood are called veins, and from the heart the vessels which carry the pure blood or oxygenated blood are called arteries, right? So as you can see, there are two major vessels. One is, vena cava, and some is and another is called aorta. Ascending aorta, descending aorta, they are the aortas. But there are two major vessels of which goes to the heart, which comes to the heart, right? So one is vena cava. Vena cava is, again, as you can see, the name superior vena cava is, why it is called superior vena cava is because this is one of the largest or biggest vessel in the heart and it goes out of the heart. Like the blood, the blood comes to the heart from here. Vena cava means blood comes to the heart from the vein, right? So it collects all the blood from all the veins, which comes from the different body parts, different body organs, and it comes to the heart, right? Similarly, aorta, this is aorta. From aorta all the blood goes out of the heart, right? From the aorta all the blood goes out of the heart, which is pure. And from the aorta there are different branches which takes the blood to whole body, right? So this is like how
Audio video రెండు ఆఫ్.
can you please mute yourself? Anyone, someone's mic is on. Please mute yourself, otherwise I have to mute everyone. Okay, I'll mute everyone actually for some time, and then if you have questions please write. Okay guys. Yeah, so this is like, this is the heart structure, and let me just follow my cursor here. So the blood, whole blood from the whole body. So when we talk about the whole body, there are majorly we divide our body into four different sections. Upper section where there is our brain, above than the neck, that is called upper body, right? From there, upper part, the blood comes from the carotid vein. Okay, carotid vein means there is a carotid carotid veins means the veins which are carrying the blood from the brain, or the brain surroundings, or from the different parts of brain and neck and ears. They collect all the blood and they get into the heart, right? Into the, that connects to the superior vena cava, again. So that carries all the blood, collects all the blood and carries to the heart through the superior vena cava, right? So upper body, then the middle, your thoracic part, the entire thoracic part including chest, stomach, and your body, right? And there are different tissues, there are different organs like liver, heart. Again, heart itself needs the blood and nutrition and oxygen. And then your lungs and your different other parts, right? Which gets the blood, which gets the oxygenated blood, and drops the deoxygenated blood back to heart. So all the small vessels from the organs come to the superior vena cava and dump the deoxygenated blood into the superior vena cava. Now the major parts, again the two major parts are the upper limbs. Upper limbs are your arms, two arms, like left arm and right arm, right? So upper limbs, again similarly we have the veins in the upper arm and arms, left arm and right arm, which collects the blood from the arms and different fingers, nails, and skin. The entire arm, right? Entire arm physiology, they collect the blood from there and they get the blood and dump into the superior vena cava, which carry that blood into the heart, right? Similarly, lower limbs means your legs, left legs, right leg, including your your whole skin, your all the parts of the your legs, and the toes, and everywhere, right? It collects the blood from the lower part, right? Lower part, and that is called lower limbs, right? All the, both the lower limbs, it collects the blood and it carries again to the superior vena cava, dump the blood into the superior vena cava, and that blood goes to the heart, right? So from here it enters and the blood goes to the right upper chamber, which is called right atrium. Okay, which is called right atrium. And then from here blood goes to the right ventricle, right lower chamber, right ventricle. This is right lower chamber, right ventricle, right? And the blood goes through the right atrioventricular valve. Why it is called atrioventricular valve? Because it is between the atrium and ventricular, so we call it atrioventricular valve. And there are three flaps which is which are closing this. And in this gate, in this gate pass, or in this valve, we call it valve in the, when we talk about the cardiology, when we talk in the cardiology or talk in the medical terms, these are called valves, right? And tricuspid valve, cuspid means the flap, right? Cuspid means the flap, like you have seen the fish has the flaps, right? So those flaps are there in the heart, which makes this which makes this as a restriction or gate pass. Okay, so from here you have to, when the blood comes here, these are closed, right? When this atrium is completely relaxed, that time these are closed, these cuspids are closed, this wall is closed, right? And then it fills with the blood, and then these valves open, entire upper chamber, right atrium, get squeezed, we call it contracted, right? So it gets contracted and the whole blood goes to the right ventricle. Then similarly, after this process, right ventricle gets squeezed, or we call it contraction. So contraction happened in the right ventricle as well. And from here the blood does not go to the left atrium or left ventricle. Where it goes, because this is impure blood, right? This is impure blood, came from the superior vena cava, so it goes to the lungs, right? It goes to the lungs through the pulmonary, what guys, pulmonary arteries, we call them pulmonary arteries. Why we see, you will be a little confused here, the new people who doesn't know, or so the why we call them artery when they are getting the impure blood or deoxygenated blood, because these are carrying the blood apart from the heart, right? These are carrying blood away from the heart. So all the vessels which carry blood away from the heart, those are called arteries, right? So these are pulmonary arteries. Pulmonary arteries take the blood to the lung, right? And in the lungs, left side lung and right side lungs, there are there's a classification in that. These are right side pulmonary arteries, these are left pulmonary arteries, which are carrying the blood to the lungs. And in the lungs, with your breath, with the oxygen which is stored or which is carried with the breath, this blood gets purified and oxygenated. The deoxygenated blood becomes purified and becomes oxygenated, because it drops or it dump all the useless gases, or the gases which are not for use, and the other materials which are not for use, usually most of the gases like nitrogen and carbon dioxide majorly. So it leaves those gases in the lung, and it gets purified. Once the blood is purified in the lung, then it goes back to the heart. It goes to the heart via pulmonary veins. Again, these pulmonary veins are very specific, because these are carrying the pure blood, right? Veins usually carry the impure blood or deoxygenated blood, but here the veins are carrying the pure blood, right? And it is going to the heart. And when from the lungs, right, from the left lung through the left lung through the left pulmonary vein, or from the right lung through the right pulmonary vein, when the blood goes to the heart, it goes to the left atrium. Okay, the blood goes to the left atrium. So always remember that in the heart, the chambers which receives the blood are upper chambers, atriums. Okay, and which throw the blood out of the heart are lower chambers, which are ventricles. Okay, so atriums are always to receive the blood, and ventricles are always to throw the blood out of the heart, right? So from left atrium, the blood comes to the left ventricle, and this side, this valve is having only two flaps. Okay, this side, this valve is having only two flaps, and this is called mitral valve. Okay, left atrioventricle valve, this was right atrioventricle valve, this is left atrioventricle valve, this is called mitral valve. Okay, there are only two flaps, but in the left side there are three flaps. Why it is? Because of the physiology, because here there is more pressure, here there is more pressure, and here all the conduction system happens from this side. So we need more restricted and more strong barriers here between atrium and ventricle, right, in the right side. That's why it is tricuspid usually. Okay, and this side, not usually, 100% it is tricuspid, in every human beings. In some definitely, if there are defects, then it is quadricuspid, sometimes dicuspid or bicuspid. And this side, in the left side, it is always two cusps, always two flaps, right, in the mitral valve, right? And this is here, then the blood comes from the left atrium to the left ventricle, and where it collects, and this is pure blood, right? In the left side, it is always the pure blood, because the left atrium is collecting from outside the pure blood, it is going to left ventricle, which is again the pure blood, and left atrium, left ventricle throws the blood out from the heart. Okay, it throws the blood out from the heart, and where it goes to the whole body. Whole body through what? Through ascending aorta. Okay, there are descending aorta, there are ascending aorta, there is aorta, right? So here you can see, here you can see, uh, here you can see ascending aorta. Ascending aorta means the part of aorta, the branch of aorta which is going upside. Upside means again up to, again going to the brain, right? Again going to the brain, or to the heart as well, and to the upper limbs. Okay, and there is along with this ascending aorta, there is descending aorta also, which takes the blood to the lower parts of the body, right? Like stomach, right? Your genital systems, your thighs, your the lower peripheral part. It takes the blood to the lower part, right? As you can see, subclavian artery, common carotid artery, brachiocephalic arteries, these are taking the blood to the upper part of the body, right? And that's how the blood flows, right? That's how the blood flows here, right? From the blood enters in the heart from vena cava, it goes to the right atrium, and then right ventricle. From there it goes to the left and right pulmonary artery, to the lungs, and from the lungs it comes to the left and right pulmonary, left and right, through the left and right pulmonary veins, it comes to the left atrium, then it goes to the left ventricle, and then it goes to the aorta. And from that, systemic circulation means your entire body, it goes to your entire body, right? That's how the blood flows. Now, why it is very important to understand, right? Important to understand the blood flow, because it helps understanding the anatomy of the heart, and it will help us understanding the physiology, right? So when we talk about ECG, it's all about conduction, okay? Conduction system of the heart, and that's how it will correlate, okay? You'll understand that. So in the anatomy, this is the blood flow, but along with the blood flow, there are multiple things to understand. See, like heart wall, heart has a wall, and that wall has three layers. So the internal layer is called endocardium, endocardium, and the outer layer is called epicardium. This is epicardium here. If you can follow my cursor, this is epicardium, this is endocardium, and the middle thick layer is called myocardium. You know, this is called myocardium, and most of the functions are happening in the myocardium, because myocardium has the muscle mass. Okay, myocardium has the muscle mass, and in this muscle only all electronic waves, impulses, and blood vessels are there, right? To continue the functions of the heart, like for the for the contraction, for the relaxation, and you need blood for that, to fulfill, and a lot of things are happening in this through the muscles. So this muscular mass is called as heart wall, and this is having three layers, and most of the tasks are happening in the middle one, which is called myocardium. Okay, which is called myocardium. And if we look at the heart, the lowest part is called apex of the heart. Okay, lowest part is called apex of the heart, right? It is called apex of the heart, right? And there are anterior regions, there are posterior regions. So posterior regions means which is inside, or anterior region is which is outside. Like when we look at the chest, when we look at the chest, you look at the anterior part of heart, and posterior part of heart is behind, and apex is downside, right? So that is a normal anatomy of the heart. I hope you know that, right? But along with that, you will understand the next thing, which is very important: cardiac conduction system. Now we just learned that was not conduction system, that was circulatory system. Okay, that was cardiac circulation system, how the blood flows. So understand like that. I'm sitting in the room, right? I'm sitting in the room, and in this room there are two major systems, right? There are two major systems. One is electricity, one is water, right? So suppose this is the heart, and in heart we need both circulatory system, where the blood goes to the heart itself, and then another one is conduction system, the electricity system. So electricity system can run the functionality of the heart, right? The pumping of the heart, the functions like contraction and relaxation of the heart is done by the conduction system. So can anyone tell a little bit about conduction system and write what exactly are there? What are the parts of the cardiac conduction system? Can anyone write one or two names, or something like, okay, SA node, AV nodes, absolutely, bundle of Hins, okay, bundle of His and Purkinje's fibers, okay, okay, yes, absolutely. Anything else, guys? Okay, beautiful, right? Anyone else who wants to answer this? Versa has answered. Anyone who wants to answer? What SA node is called in the heart? Can someone tell me? What SA node is called? Pacemaker of the heart. Pacemaker of the heart or permanent pacemaker of the heart? That is called permanent pacemaker of the heart, right? Because that doesn't stop, and that comes with, that comes complementary with the birth. That comes complementary with the with the birth, right? So it is conduction system. You are writing wonderfully, right? Yes. Yes, pace setter. Okay, pace setter. Yes, it is pace setter, and it generates the SA node generates all the impulses. That is the main thing. That is the main thing. So cardiac conduction system is actually the specialized. There are the specialized muscles which are in the heart walls, as I was showing you in the myocardium, right? In the middle layer of the heart wall, there are specialized muscles which are just made to pass the signals. Okay, there are the special muscles which are especially made to pass the signals, or we call them the impulses, right? To pass the impulses to each other in the entire wall, so the wall can function in contraction and relaxation. Okay, so these muscles cells send the signals to the rest of the heart muscles, causing a contraction or relaxation, right? This group of muscle cell is called as cardiac conduction system. So the whole the outer layer and inside also, see, the wall is not just outside. In the in the heart also, in between the heart also, in between four chambers also, there are the same muscles, right? There are the same muscles which carry, or which carry the same type of muscles which are helpful in the in the functions of contraction and relaxation. In that, again, there is this series of impulses which carries and helps in contraction and relaxation, right? So this entire part collectively is called cardiac conduction system. Or and then in middle part, if you see there, say, let me go back here. So see, this is outer part. This is the major part where the contraction and relaxation happens. But other than that, there are different parts also in the middle of the heart. If you look at this, see, just this part. This part is not the wall of the heart. This is between two chambers. This is called septum. Okay, this part is called septum. Septum between right ventricle and left ventricle. This is between two ventricles. This is called ventricle septum, right? Which separates the left and right ventricle. Which separate left and right ventricle. This is called ventricle septum, and this has the same muscles where all the functions happen similarly, right? Because when it squeezes the ventricles, this also helps, the septum also helps, right? And other than that, in the upper part, this is the muscular area. This is the muscular area, including the pulmonary trunk, including the pulmonary artery. This is the muscular area, and which divides, this is again the septum, which divides two atriums, left and right atrium, and this septum is called atrial septum. Okay, or atrial septum, right? This is called atrial septum. Okay, between two atrias, right? So there is not only these two septums like ventricle septum, atrial septums, but there are atrioventricular septums also, which which defines the difference between atrium and ventricle. So here, not only the walls, the valves are the part of septum. So this septum, from here to here, this septum is called atrioventricular septum, AV septum. Okay, this divides, or this differentiates between atrium and ventricle. Similarly for the left side, right side, and similarly for the left side, right? There are the septum, there are the septums, and in septums only there is this a body called valve, valve. So from these valves, the blood flows to the another chamber, right? But these are called septums. So here are usually the four chambers, and there are majorly there are four septums. Separately there are four septums, right? One is between the valvular, between the ventricles, so ventricular septum. One is between the atrium septum, atrial septum, and two are between the left and right, or if we collectively see, that is one, right? That could be a big one between atriums and ventricles. That is atrioventricular septums, right? So these septums also have the same muscular energy and same muscles which help in contraction and relaxation, right? So you have to understand this also. This is very important part, okay? So there are, this is the collectively, this is called conduction system. There are majorly the four and actually five parts. One is, SA node, sinoatrial node, which is also known as the pacemaker of the heart, permanent pacemaker of the heart. Another one is AV node, right? Another one is AV node, then bundle of His, and then bundle branches, then Purkinje's fiber. You will understand that. So two types of cells control your heartbeat. One is conduction cells, which carries the electric signals or impulses. Then another muscles, right, which helps the contraction of the heart, right, to throw the blood out of the heart chambers. Like if it is in the ventricles, it throws to the arteries and the body. If it is in the atriums, it throws to the the ventricles, right? And from atriums to ventricles. And if it is in the ventricles, the contraction throws the blood from the right ventricle to the lungs, and from the left ventricle to the body, right? So similarly it functions. So there are two specific types of cells are there in the cardiac conduction system. One is conducting cells, which actually carry the electric signals or impulses. Another are muscle cells, right? Now look at this, you will understand the whole thing, right? Previously you just learned the circulatory system, but now we will be talking about cardiac conduction system. So in the cardiac conduction system, you will see that first part is the sinoatrial node or pacemaker, permanent pacemaker of the heart, right, which generates the impulses, the whole story begins here. The whole story of the arrhythmias, whole story of when we talk about ECG, whole story of the contraction and relaxation starts here, right? There is a node called sinoatrial node. And see, this is just a reflection of the sinoatrial node. It doesn't look like this, okay? This is just a point in the muscles, right? This is just a point, a little point in the muscles, in the upper chamber. I mean in the upper chamber, which is called the right atrium. In the right atrium also, at the upper upper side of the upper side of the right atrium, there is this node or this point, right, from where all the impulses are generated. And this is somewhere at the edge of superior vena cava, right? Superior vena cava, from where the vein collected all the blood, all the impure blood. So this is at the edge of superior vena cava in the left atrium, right? So this is the exact location of left of the sinoatrial node, right? SA node, right? This is the exact location of SA node. It generates the impulses from here, and those impulses goes to the atrioventricular node, AV node, right? Which impulses goes to the atrioventricular node. And then from atrioventricular node is again a point, point at the lower side of left atrium, and at the edge, or we can say at the septum, which is there in between of the right atrium and right ventricle, right? In the septum of right atrium or right ventricle, in the lower part of left atrium, but at the edge of this septum, right here, it collects all the impulses, and it then regulates them, and it sent to the other parts, right? So this is connected to a very strong wiring system. In the layman language we call it wiring system, but these are impulse generated or impulse transmit these are called transmitters. These are called transmitter nerves, right? This is the part of nervous system. This is the part of nervous system, okay, actually controlled by the nervous system, right? So these cells are actually the conduction system of the heart, but these are also regulated by the sympathetic nervous system, right? So these nerves or these cells, or these cells are carrying the whole impulses, and going to the ventricular septum. In ventricular septum, this whole this whole the major chain of impulses, or major chain of these cells divides into two part, right? Divides into two part. One goes to the right side, one goes to the left side. One goes to the right side, one goes to the left side. So which is going to the left side is called as left bundle branch, right? So this is the whole bundle of, cells. This is the whole bundle of, cells or nerves, the signal carrying nerves, and this divides here to the left and right side. So the left side, all are called as left bundle, okay, left bundle branches, okay, and to the right side, these are called as left bundle, sorry, right bundle branches. So right bundle branches, left bundle branches again. So this is the major chunk of the nerves, and this is again divided into two, again a smaller part, and then from here single nerves are going to the entire wall of the heart, right, entire wall of the heart, and these are called fibers, right, these are called fibers, and these fibers are controlling the entire heart, right. The last part of the conduction system is fibers, okay. These fibers are called as Purkinje's fiber, right, Purkinje's fiber. So understand now, first part is sinoatrial node, then after sinoatrial node, atrioventricular node, then the bundle branch, sorry, then the AV bundle, atrioventricular bundle, and then the bundle branches for the left side, right side, and both the side there are Purkinje's fibers. So what is the exact function? It generates the impulses, then it collects the impulses, then it connects to the connects the atria to the ventricles, like from here atria to the ventricles, and conduct the impulses through the intraventricular septal. Intraventricular septal means this, through the intraventricular septum, and then Purkinje's fibers depolarize the contractile cell for both the ventricles to contract the chambers, right. Now the major part, what helps here is, what will help you in understanding is that this part, this SA node, when it generates the impulses volts, right, electricity. It is actual electricity, but at a very very low voltage, right. So those voltages are generated here in the form of ring, okay, in the form of ring, and that circulates like this happens, everything happens in the friction of seconds, okay. It happens within the fraction of the second, right. So like within 100 part of the second, right. So impulse generates from here, and it spins through the entire atrium, right. It spins through the entire atrium like this, okay. This is the whole process which happens and how it starts, and then it reaches at AV bundle. It reaches at AV bundle, okay. It reaches as AV node, right. It reaches the AV node, and here when it reaches, it takes the pause of 10 milliseconds, zero point 0.1 second. It takes the pause of 1 second. And why this pause is because it waits for the entire atrium to get empty, so the remaining blood goes to the ventricle before this chamber, before the right chamber, right atrium is completely contracted. If it is completely contracted, means the whole blood goes to the ventricle. There is no blood in the atrium at that point of time. That is called depolarization, okay. That's called depolarization, and it is a break of 0.1 second from here to here, and like from here to here, and from here when it is transferring the impulses to this AV bundle, okay. So it delays by 0.1 second, and this is because of the spinning, because of the spins, and that spins are in the whole atrium and atrium wall, atrium wall, right. And when it reaches here, the whole atrium is contracted, right. And when it is contracted, the whole blood goes to the right ventricle, right. And definitely when it goes to the right ventricle, this closes, and again when it relaxes, the blood from the superior vena cava comes to the atrium. So this is the whole how it processes, right. Then once the impulses are in the AV bundle, it directly non-stop it goes to the different parts of the heart, like through the left bundles it will go to the left side, through the right bundles it will go to the right side, and helps in the contraction of these chambers, right. Now the crux or the point in story is the diseases, right. We are understanding the conduction system, but what are the diseases related and how the diseases happen? So see, there is no direct hit, right, that there is no plug which will stop the electricity or stop the intranodal pathway of conduction system or cardiac conduction system. But there are problems, right? There are problems like the internal injuries or internal diseases because of the kids, because of the young age, or because of sometimes premature birth, or because of immature developments. There are congenital diseases, right? Congenital heart diseases like these septal defects, right? ASD, VSD. VSD is ventricular septal defect. ASD is atrial septal defect. And there are septal defect, there are valvular defects, there are multiple congenital problems. Valvular heart disease and congenital heart diseases are there, PDA, VSD, ASD. There are the problems which affect the structure of the heart, and along with the structure, the conduction. Conduction is damaged or conduction is broken. Okay, the conduction system is broken or damaged. Okay, or maybe in the with the development of these diseases, it stops working, or it is broken in between, right? So the impulses which are carrying thorough freely here, which stops or gets disturbances, and due to that people get arrhythmia, right? So not only the congenital heart disease that is in the kids congenital heart disease, but in the elderly, it could be the heart attack, it could be heart failure, it could be blunt injuries, it could be the toxins, it could be alcohol, it could be smoking, it could be diabetes, hypertension, anything that affects the heart muscles, and because of that the conduction system gets affected and people get arrhythmia, right? People get arrhythmia because of that is the majorly nature. And sometimes definitely the drugs, genetics, which are also the contributory part in some specific arrhythmias. Not all arrhythmias, but in specific arrhythmias there are the genetic factors as well, right? So it works like this, right? Let's understand one by one. So first is sinoatrial node. So the sinoatrial node lies on the right side of the partition that divides atria near the bottom of right atrium. Oh, sorry, I think we went to this sinoatrial node we were talking about, right? So sinoatrial node, also referred as the pacemaker of the heart, coordinates the heart contractions located in the upper wall of the right atrium, as we discussed. It generates the nerve impulses that travels throughout the heart wall, causing both the atrias to contract, right? Spinning process, as I told you, the spinning process, right? So through the spinning, it travel through the whole heart wall. Heart wall means the in the atriums, right? In the atrium, it creates the contraction of the atrium, and then it reaches to the AV node, right? So your autonomic nervous system controls it. Autonomic nervous system controls it how fast or slowly your SA node send the electric signals, right? So your autonomic nervous system makes this the faster and slower rate response of your heart rate or electric signals. So can someone give me the normal examples of your fast heart rate or slow heart rate, guys? By written, you can write in the chat box. I have closed the Okay, can someone write in the chat box? Yes. Is it? Are you not able to see the words? I am seeing this is perfectly fine. Guys, are you not able to see the screen? Okay. Yes. So what was that, guys? Like, what am I asking? Yeah. So can someone give me the example? Yes, give me the example. Tachycardia, bradycardia, tachycardia. These are arrhythmias. I'm asking the normal examples of high heart rate, low heart rate, and how the autonomic nervous system controls it. Some examples: running, absolutely, running, sleeping, running, fever, exercises, yes, cycling, right? Yeah, these are the things. Other than that, some foods, can someone name some foods which raises your heart rate, which raises the electric signals in the heart? How many coffee lovers or coffee addictors here? Coffee, caffeine. Caffeine is one of the major. Yes, alcohol also, but caffeine is one of the major danger subject or danger element to your heart, to your conduction system. Okay. If it is addicted, if you are taking more than a coffee, more than one coffee, there is a limit for the heart. If you read the cardiac guidelines of AHA or ESC, there are the specific doses of caffeine which are suitable for the heart. Other more than that, if you are taking, you are keeping yourself in danger, and you are inviting the arrhythmias, right? You are inviting the arrhythmias, right? Because caffeine has the direct impact on your autonomic nervous system and direct impact on your heart rate. Did you ever feel, how many of you have felt before that, if you are drinking coffee in the evening, if you are having a coffee in the evening, you don't get sleep? Did you ever feel it? If you are having coffee after 6 p.m., you don't get sleep easily, right? It is very common. It is very common because that, keeps your autonomic nervous system up entire night, or up till the effect goes down, right? Up till the effect goes down, it keeps you awake. It keeps your nervous system awake, right? So you don't get the sleep. This is because of the caffeine, right? So I'm not against the caffeine though, but I'm telling this is the substance which affects the heart muscles and autonomic nervous system the most, right? So why? Because this part of the nervous system direct hormones that controls your heart rate based on what you are doing, right? For example, your heart rate increases during the exercises and slows down when you are asleep, right? The autonomic nervous system includes your sympathetic nervous system and parasympathetic nervous system, right? So sympathetic nervous system means flight and fight responses. Flight and fight responses. Suppose you are going on a road and you saw a tiger. What you will do? Yes, guys, what is your response? If you are going on the road and if you see a tiger, what you will do? Tell me. Yes, you will run. Okay, very nice. Some people will freeze there only, right? Some people will be, will freeze automatically, right? Yes, run. Usually people come in the panic. So that is called flight or fight response, sympathetic nervous system. Flight or fight response means you either run away, your body gets completely excited, your nervous system completely gets excited, and in that excitation phase, either you become so brave or you freeze, right? You freeze. So parasympathetic, when the parasympathetic nervous system works, you completely freeze. You completely freeze. That is under the rest stage. Okay. Or when you start fighting or you start thinking, mostly majorly sympathetic nervous system causes the flight and fight responses, where you either run, you either you are not scared that time, you are courageous, right? But that's not always good, right? That is in some systems or in some scenarios it's good, but not always, right? So flight and fight responses makes your SA node faster, which increases your heart rate, which increases your pass away. Sudden shock or pass away. Okay. Okay, fine. So this was extreme though. People usually don't pass away by themselves. They are, attacked by the tiger, right? They're killed by the tiger. Okay, so fight or flight response, that's a joke apart, but fight or flight response, when your sympathetic nervous system is completely excited, or your nerves are, in the, highly regulated responses, they are not regulated responses, they are showing the they're completely showing the dysregulation in the responses, and the dysregulation is towards the faster responses, so your SA node work faster, which increases your heart rate. Similarly, when you are in the rest and digest space, your SA node works slower, which decreases your heart rate. So do you know that the pathophysiology is very interesting? Pathophysiology is very, very interesting of the conduction system, and not only the conduction system, autonomous system. So see, when you are in the fight and flight response, your body gets different responses. Different parts do the different give the different responses, right? Your brain will be super active at that time, right? But your gut will be completely down. You know that? You don't know that? Your gut will be completely down. Your genital system will be completely down because of the sympathetic nervous system, the fight and flight response. There are multiple things where you need the energy at the right space, where you need the energy at the right for the right activity. So your gut will automatically slows down. It will stop, stop working, right? It will slow down the entire digestion system. So your energy is used in running, in or fighting, or for the fight. I mean, it is ready, your body is ready for the fight and flight response, right? Your all the happy hormones are completely shut down that time, right? Because you need your energy to the fight and flight responses, right? So that's how it works, right? And when you are in the rest and digest response, you will be, your digestion will be super active, but your mental state will be relaxed, like when you are sleeping or in the colder regions, right? When you go to the colder regions, your body needs more energy, your gut slows down, right? Your digestion slows down, right? And usually in cold, your gut uh, your gut slows down, right? So it is like, it is a natural system, it is the body system, it is the pathophysiology of the body, like how the sympathetic nervous system works actually. Okay, so we will not stuck here. Sinoatrial node, and then atrioventricular node, which is again the second part of the conduction system. That is also, it is actually located at the on the right side of the partition that divides atria, right side. And actually that is not only dividing the atria, but as I told you, this is the edge of right ventricle also. The edge of right ventricle, I mean the upper part of the right ventricle, atrioventricular septum, that is definitely in the this atrioventricular node is definitely in the atria, but it is also at the upper edge of atrioventricular, atrioventricular septum, right? So that's why it is called atrioventricular node, right? So that divides, I mean, so it is at the edge of all three, right? All the right atrium, left atrium, and the right ventricle, right? So this triangle is called as triangle of Koch. Triangle of Koch, usually AV node is in the triangle of Koch, right? When the impulse is generated by the SA node reaches the AV node, they are already delayed about a tenth of the second, as I told you. 0.1 second they are delayed, 0.1 second they are delayed. And because of this delay, why it happens is because the right atrium wants to empty itself, right ventricle wants to empty itself, right? And that's why it happens, right? That's why it happens. Okay, one second, I'm getting a call. Yes, guys. I'm so sorry. I got a call actually. Yes. So reason why it's called triangle of Koch, because these three septums or the chambers are meeting there. Okay. And if you want to know more, that I maybe I might be missing something, so you can definitely go and check out more. But it is because here I think it was discovered by the Koch, so that's why we call it triangle of Koch. Okay, so if you want to know more, you can definitely read it. But definitely it is a very very crucial thing. And most of the actually it is because of the boundary, most probably it is because of the boundary only, because boundary of all three, like left atrium, right atrium, and the septum which divides the ventricle and atrium, right? So here, that's why it is called triangle of Koch, most probably. And if you have any specific things, you can please find out and let us know as well, right? So when the impulse is generated by sinus atrial, sinoatrium node reaches the AV node, they are delayed for about a 10th of the second, right? And this delay ensures that your atria are completely empty of the blood before the contraction stops. The atria are definitely the upper chamber, so it is because of that, right? It is because it wants the atriums to get empty, right? Get empty, so there is no blood, right? And then atrioventricular bundle, right, that is called, also called as bundle of His. So it is a branch of fibers, nerve cells, that extended from your AV node, and it divides into two parts, left bundle branch and right bundle branch. And these His of bundle runs down in the length of atrioventricular septum and then into the ventricular septums, and which goes to the left side and right side of the ventricle, right? So the left bundle branch sends the electric signals throughout the Purkinje's fibers to the left ventricle, and right bundle branch sends the electrical signals through the Purkinje's fibers to your right ventricle. So whenever there is a dysfunction, or the problem or functional problems, if there are the functional problems or any kind of problem in the left side of the bundle branch, that is called as left bundle branch block, LBBB, right? LBBB. If it is in the right side, that is called RBBB. RBBB is not that dangerous, but LBBB is dangerous because it usually happens because of the high-end arrhythmias like SVRT, NVRT, and it happens because of the severe cardiac attacks or severe cardiac arrest, or severe myocardial infarctions. Usually with the STEMIs, okay, yeah, ST elevation MIs, right? So that's why LBBB is the sign, and LBBB is could be because of your cardiac arrest, heart attack, or maybe because of the severe arrhythmia, or it can cause the severe arrhythmia. This is a symbol, or this is a sign of the severe arrhythmias in ECG, right? So we will study everything. Then Purkinje's fibers are branches of specialized nerve cells. These fibers extend from the atrioventricular bundles branches to the left right ventricle. Purkinje's fibers rapidly relay the cardiac impulses to the myocardium, and like the middle layer of the heart, right, from where both the actually four of the chambers are going to contract or helping the contraction system, right? So as they contract, blood flows from your right ventricle to your pulmonary arteries, and from your left ventricle to your aorta onto the body, right? So you can see here sinoatrial node again, sinoatrial frontal, this is the frontal plane through the heart, right? So sinoatrial node, and then it goes spinning through the atriums, and it goes to the AV node. From the AV node, it goes to the AV bundle of the His, and from here it divides into two parts, right bundle and left bundle branches, and then Purkinje's fibers throughout the heart wall, and that especially cause the contraction. So here you can see the signal circulation, how the signal circulates. Signal circulates from sinoatrial node pacemaker, to the AV node, like internodal bundle and fibers, right, in the entire atrium. These internodal bundle fibers are there in the entire atriums, and from that atrium, it goes to AV node, and these bundle fibers are there in both the atriums. So, from both the atriums, it goes to the AV node, and from AV node, it goes to left side and right side of bundles, and from that it goes to the Purkinje's fibers, and from Purkinje's fibers it goes to the right septum. If it is, I mean, sorry, if it is the left bundle branch, then it goes to the left septum or left lateral wall, and which causes the contraction of the left ventricle. If it is right side, then right lateral wall and the septum, right side of septum, and then it causes the right ventricle contraction. So this is the usual circulation of this, okay? So have you ever wondered what causes your heart to beat? So definitely your heart beats as a result of the generation and conduction of the electric impulses. So in the first step, pacemaker impulse generation, which is done in the SA node, then it goes to the AV node, then AV node impulses the impulses are conducted by AV node, goes to the AV bundle impulses conduction, and that these all are the symptoms, these all are the systems again, okay? And then it goes to the Purkinje's fibers, and cardiac conduction definitely is influenced by various factors, as we discussed: exercises, temperature, endocrine system hormones, or the caffeine, food, everything, right? So we can actually stop here today. This is an initial class, so we almost took 1 hour. Definitely in the next class, I'll complete the entire pathophysiology, entire signals, and then we will learn about electrocardiogram and what are the diseases related, what is the ejection fraction, how it goes, and then it was actually in this class only, but I'll take it in the next class as I'm also right now out of station. And you know in next classes we will take this and more. I have all the material ready, but the only crunch is time. We will take it. Okay, when we will have the next class, most probably we will have it on Saturday or Sunday. Once we will have. Okay, SA node is located in RA. Definitely, it is located in RA, upper part of the RA, in the upper muscles of RA. Right atrium, at the edge of superior vena cava. When the superior vena cava opens into the right atrium, at that edge there is the point. There is a little node or little point where this that is called SA node. Okay, so how will signals goes to LA, left atrium? No, because this chamber, there is, see, suppose there, I mean, the upper chamber is only one, two atriums. Upper chamber is called atrium, right? Atriums, and that is divided into left part and right part because of the septum. So septum doesn't interfere with the wall of atrium, upper wall of the atrium. Septum is like in the room, you just keep one thin plate, or you keep one division, right, which divides the room into two parts. So that division doesn't interfere with the roof, that division doesn't interfere with the floor, right? The division doesn't interfere with the floor. So all the impulses, all the wires which are going through the floor or which are going through the roof, those are not interfered, right? Those are not interfered. So when the impulses are generated, these are generated throughout the atrium, right? Throughout the atrium means left and right part also. But definitely because of the septum, the intensity or the voltage of these impulses are higher in right side and lesser in the left side, lesser in the left side, and more of the work. See, if you look at the functionality and the workload, more of the workload is done by the right atrium, because it takes all the blood and throw that pressurely to the right ventricle, right atrium to the right ventricle. But when it comes to the left ventricle, it has the blood, but which is coming from the lesser forces from the lung, right? Lesser forces, it needs less energy, it needs less energy or less power, less voltages to contract, and which sends the blood to the left ventricle, right? So that's why definitely there is a one chamber. The wall is only one, right? The walls are actually walls, like upper wall and lower wall is one only. There is a just septum is just a divider, right? Or septum is just a division in the room. Okay. Sachi. Oh yeah, definitely. I'll not take ECGs parallelly, because there were so much of uh, disturbances in the group. So I had to take this class. I had to start this class. That's why I took the class today. And otherwise, I'll definitely not matching with the SPSS. Whenever your SPSS is not there, I'll take those days classes. Okay, don't worry. RA and LA contracts at the same time or separately at the same time, usually at the same time. Upper chambers at the same time, lower chambers at the same time. Okay, so the blood goes to the left atrium and right atrium at the same time. Okay, and the blood goes to the lungs and the aorta at the same time. Okay, yes, we will upload it to the channel. Yes, absolutely. Okay, yes, any other question, guys? Any other questions? No questions, then we can wind up, and I'll see you. I'll inform you. Batchman help 4. Okay, what is this? What actually is joint diastole? I'll take this in the next class. Diastole and systole. Diastole and systole are the part of rhythm. Okay. Diastole and systole are the part of rhythm, and definitely these helps in the contraction and relaxation of the of the heart muscles, which helps in the definitely the blood, right? When, because the major function of the heart is pumping the blood to the lungs or to the body, right? helps in purifying through the lungs, because lungs and heart are the connected system, right? So the blood goes to the lungs and it gets purified, comes to the heart, and heart throws it. So diastole and systole, these are the two functions, and there, this is related to the volume also, volume of the blood, and it helps in the contraction, right? So I'll take this in the next class. This is the part of next class, diastole and systole. I'll take this. Okay. Watchman also I'll take. Sir, in the anxiety, why bradycardia is seen? No, in anxiety, there is no bradycardia. This is just a myth. Okay. Bradycardia usually is not in anxiety. Is it in depression? Okay. In depression, you will see, bradycardia. In anxiety, you will always see tachycardia. Okay. In anxiety, that is tachycardia. In depression, usually your mind slows down and your sympathetic nervous also slows down. And in depression, you usually get bradycardias. Okay. No, I informed for this class also. I informed yesterday, not today. Nikhat, I informed yesterday, dear, that we will have a class tomorrow at 8 p.m. Not today. Yes. Okay, guys. So thank you very much, and we'll see you in the next class. Bye bye. Take care, guys. Thank you. Thank you very much. Thank you. Thank you.